Wonderful. Welcome everybody to Pre-Health Shadowing. Pre-Health Shadowing is a student-led nonprofit organization focused on making flexible and accessible learning opportunities for students via our online platform. Pre-Health Shadowing gives students various opportunities for shadowing, volunteering, and leadership. In the future, we're looking to open our mentorship program as well as our high school transition program. So listen up for that during my presentation. Since pre-health shadowing is open to anyone who is interested for absolutely no cost, this allows people from various parts of not only the US, but the world to connect. So go ahead and drop in the chat where you guys are Zooming from today. Wonderful. Welcome, everybody. It's so great to have you. Just a couple housekeeping things before we begin. We do send out weekly emails with all of our upcoming speakers with their registration links and Zoom IDs. So if you are not receiving that, here is how to change it. You're going to go to the URL at the bottom, www.prehealthshadowing.com/join us. You're going to put in your information. And once you do that, you should be receiving an email from Pre-Health Shadowing. You're going to spotlight search Pre-Health Shadowing in your email and mark all of our emails as important. Another thing you could do to make sure that you receive our emails is save Pre-Health Shadowing as a contact. This lets your email provider know that you want it to skip the junk, skip the spam, and go directly into the inbox. If you guys have any questions about this, feel free to reach out to us at info@prehealthshadowing.com. I have an update for you all. Pre-Health Shadowing has closed captioning for all of the live sessions to accommodate students with disability. This is one of our initiatives as we are hoping to create accessible opportunities. We want to let everybody know with different abilities that you can achieve your goals. And so Pre-Health Shadowing is working to diversify the healthcare field. If you are looking to get involved and give back to the community, Pre-Health Shadowing has partnered with Mask for Mask, which is a woman-led nonprofit organization. For every 4 masks that are purchased, you can have 4 masks donated to someone in need. This could be a homeless person, this could be a hospital that is lacking resources, or any other group or community that does not have the resources during this global pandemic. If you guys are able to, we do have a code. If you use the code PHS15, you will get 15% off of your purchase. Help us donate masks to the less fortunate. And yeah, be sure to check them out on Instagram, and their website is maskformask.com. If you are interested in getting published, Pre-Health Shadowing is now taking blog submissions. You can submit an article, a reflection, a review, or a success story to our editor-in-chief to gain the opportunity to be posted on the official Pre-Health Shadowing website. So if you are interested in this, it does look great on your applications, CVs, and resumes. Be sure to check this out. Also, write down the link to this because it's an exclusive opportunity for our live session viewers only. prehealthshadowing.com/blog submissions. I invite you all to pull out your phone and scan this QR code. This QR code will take you to a page on our website, the donate page. We are a student-led nonprofit organization. We are working to fight inequity in health education and promote diversity in the various healthcare fields. And so please help us by keeping this program alive so that we can provide opportunities for those who do not have the opportunity. You can donate through various platforms, GoFundMe, Venmo, or via check. We appreciate anything you guys are able to provide. We ask that if you are not financially able at this time to support us by sharing this link. So we ask that if you are watching this video right now, please share this with 5 other people. If all of our viewers are sharing this link with 5 other people, then we potentially could have enough money to upgrade our website and have more people join us on our journey. Thank you, guys. If you are a high schooler and you are interested in joining the Pre-Health Shadowing team, we do have a new program called HTP. This will allow you to establish connections with multiple high schoolers, like-minded students around the nation, and establish Pre-Health Shadowing Club as a chapter in various institutions. If you are looking for a mentor, a virtual mentor, may I add, during the COVID-19 pandemic, we are hosting a mentorship networking weekend. This is a 3-day event that will take place on February 19 to 21. You have the opportunity to meet with up to 2 professionals a day for a total of 6 professionals if you choose to attend all 3 days. You not only get to gain a potential connection with a mentor, but also meet with other like-minded students. This is an invite-only event, and so I will tell you now how to gain an invitation from Pre-Health Shadowing to our mentorship networking weekend. It's pretty easy. What you have to do is go to our Google Drive, download 3 pictures, register as a volunteer on our website, post those 3 pictures on your social media. Once you fill up your bingo board that is beautifully placed to the right of the slide, you will submit it on our website, and it's that easy. That is how you get your invitation to our mentorship networking weekend. If you guys are interested in learning more information about how to participate, go to our website, prehealthshadowing.com/mentorshipbingo1. If you are interested in helping out, we have a very flexible volunteering program. You can sign up on our website. Stick around for the end of this session where I'll go more in depth about the various projects that we're doing and how you can get involved. If you're joining us for our live session today, go ahead and post Pre-Health Shadowing on your social media for a chance to get reposted on our official webpage for our session right now. If you guys are interested, tag at Pre-Health Shadowing and we will be sure to check you out. With Pre-Health Shadowing, students can take a post-shadowing assessment to receive a certificate that verifies their virtual shadowing hours today. Be sure to take good notes and ask our professionals some great questions. Feel free to drop your questions in the chat throughout the session, and we'll be sure to ask them during the Q&A portion. Without further ado, I would like to welcome to you our professional today. Welcome, and thank you so much for joining us.
Thank you so much, Nina. So welcome, everyone. Hello, I'm Dr. Gabriela Lagreca. I'm a dentist. So I've been told that in the past you had experience with shadowing multiple people in the health careers, but not as many dentists. So I'm really curious to know, because I might be one of the few dentists in the room. Who are you? What best describes you? And Nina, if you could pose, excellent, perfect timing. Let's get to know each other a little bit. And you'll have a poll so you can tell me who you are.
All righty. And I'm going to go ahead and share results so everybody can take a look around the room.
Excellent. I got some pre-dental students there, so hopefully I could get them involved into what dentistry is about. And those that are going to be in the medical field, I still believe it's very important that you know what dentistry is about, and maybe some things, hopefully, that at the end of today are new and you didn't know about dentistry. I'm going to go ahead and share my screen. And Nina, you thumbs up if everything looks okay when I full screen. Excellent. So a few things you need to know about me, not only that I'm a dentist, but also, as you can tell from my accent, I'm originally from Venezuela. So I have a dual background. I completed my dental education in Venezuela, and then I did my specialty training here in the US. So I'm going to be walking you through a little bit of my background and then basically what my specialty is about. And about my background, as I said, I come from Latin America, a very warm country, and I'm located right now in Boston, Massachusetts. I noticed some of you in the room are in Boston. So you could know already the weather and the culture and everything is very different. But I came from a house where nobody was in the medical or health or dental field at all. My dad is an engineer. My mom is a designer. And my brother became an engineer and my sister became a designer. So you might be wondering, why did I even choose a career in health? And as many of you, I was curious about a health career when I first encountered my dental appointments. And these are my brother, my sister, my mom, and my dad. And I always show them in all the presentations because I really love my family. I'm the oldest of 3. And I guess I took the lead of doing something different, very, very different, not only within my core family, but within my extended family. As a first generation dentist in my family, I realized or start thinking back, why did I even choose dentistry? And to be honest, I think it was a very innocent decision. I did not overthink it too much. I said, oh, I like my dentist. I think what she does is really cool. I shadowed her for a little bit. I thought that it was interesting. But later on in time, when I started working on making my applications and writing my personal statements, I went deeper into the true reason. And I grew up in a house, as I said, my dad is an engineer, mechanical engineer. So he was trying to make everything functional all the time. And my mom is a designer. So she was trying to make it pretty. So I grew up in this house where this balance between function and art was present in everyday activity. But I was naturally curious about science. I always liked the science subjects at school. So to me, dentistry really covers or is a beautiful merge between function, art, and science. I told you already, I went to dental school in Venezuela. I went to a public dental school that is the largest in the country. So each class, we're talking about 300 people in dental school in Venezuela is 5 years. So it is a quite large dental school. And the dental school experience is slightly different to the American dental school experience. It's a public dental school. We serve a lot of underserved populations. And of course, we don't have as many resources available, but the knowledge we receive is very wide. These are some pictures that I got from my time in dental school. What you have on the upper right is where my first set of dentures for my patients that are on the left. And down below, you have some huge teeth. And these were actually the preclinical work that we did to learn dental anatomy. We will have these macro teeth that we will paint, and we will identify surfaces that were concavities were with one color, prominence were with another, and that's how we learned dental anatomy back in 2003. So things have changed and technology has changed. However, the face of dentistry in Latin America is still very different. So we do serve, in general, a lot of populations that, as I said, they don't have access to proper medical or dental care. But long story short, after 5 years, I completed my dental degree and I worked for a few years. And my dad got me my medal when I graduated because he was a university professor. And I will tell you later why I mentioned that. But at that point, after practicing for 1.5 years or so in Venezuela, I started looking for more. I felt that although I was comfortable with where I was not happy. And that's when I took the hard decision or easy decision to pursue a specialization. And in dentistry, there are 11 certified specialties. And probably the ones that you know the most are endodontics, if you ever needed a root canal, orthodontists, if you have braces, oral surgeons, everybody knows. But you also have periodontists, prosthodontics, public health, and so many others. So I was really clear that I wanted to do something related with reconstructive. So something that it was building, because that's what I had at home, somebody building something pretty. Then I learned that the specialty that I was interested, which was prosthodontics, was 3 years. And I'm going to be completely honest with you. After 5 years of dental school, the last thing I wanted was to go back to school another 3 years. I was tired. I didn't want to invest the time and the money. So I decided to come to Boston from beautiful Venezuela with nice and warm weather to this. And this was actually at the time of my arrival. We just had hit a storm. And I took this picture with my cell phone because I found it funny that I was switching completely, not only a career, but a life. And this really represented what a shift in career. That's exactly how I felt. Like my head was like dumped in the snow with all of the things that I had ahead of me, the things that I didn't know. Because the truth is that I didn't even know what I didn't know until I got here and until I specialized. So I attended to Tufts Dental School in Boston. And my first experience was 1 year fellowship in implantology. And, as I told you, I was in Venezuela, not ready to commit to a long residency. So I said, I could do a 1 year fellowship. That sounds appealing. I could learn things, gain experience, and go back. But I'm going to confess that after that year, I felt like I did not have enough. I felt that it was just an opening and a taste of all of the things that I could learn. and I decided I was ready to the next step in my career, which was specializing. And I guess believing what I had to learn was even more of what I knew already. It really allowed me to give up temporarily the things I knew. I could have gone back with what I knew and work and probably have a good life and a good practice. However, I really wanted to take my knowledge in prosthodontics and in dentistry to the different level. And I felt that that's why, or that's the reason why I decided to stay. So residency was 3 years, and it was a lot of work, but a lot of fun, like it always is. And after those 3 years of many experiences, I was able to navigate truly what the specialty is about. And the reality is that if you ask me what prosthodontics is a specialty that replaces everything that is missing or will be missing. It could go from a tooth with a crown to a bridge, to an implant, to an ear. Because in prosthodontics, you replace anything prosthetically. And that was something that was completely new to me. And it opened my eyes to all of the things that I had to learn. With experience at Tufts, I was able not only to complete my residency training, also became board certified in my specialty, but I was afforded the opportunity to teach. And remember, I mentioned my dad gave me my medal when I graduated from dental school because he was a university professor, and my mom had a school of design. So I grew up in a house of professors. So I guess it was very natural to me after graduating to start exploring an academic career. And so I joined the Tufts faculty team back in 2015. And that's where I've been ever since. So I share my career between practicing in faculty practice and teaching in the postgraduate program of prosthodontics at Tufts. So that's a little bit of my journey. And you might be wondering, now I show you an ear and I told you a little bit about what prosthodontics is about, but let's talk a little bit more on detail. Let's really define what this specialty is composed. And it is defined as the restoration and replacement of missing teeth and also oral facial structures. And this is replaced with natural, aesthetics, and functional replacements. If we really look in the detail, many people associate prosthodontics with crowns, bridges, maybe dentures, but our specialty covers a lot of phases of dentistry. If you have snoring or any sleep disorders, it is the prosthodontics that helps you with the treatment of the snoring and sleep apnea disorders. If you have TMJ or any joint-related issues, it is a prosthodontics that helps you adjusting your bite for that joint problem. If you are missing a tooth, it will be a prosthodontics that will help you with an implant and potentially a crown. But also if you have either congenitally missing an ear, or if due to cancer or any traumatic experience, you will need a replacement of an eye or a nose, it is also a prosthodontics that will help you with that replacement. So a prosthodontic practice will look very complex in general. We don't really see that a single tooth type of feeling that you probably have done in your own mouth. So we're not really that type of practice that see the easy dentistry. We really see what we call complex case. And complex cases can be very different. As you see all these pictures, not two pictures look alike. But what is true about a complex case is that any dentist that see a complex case will agree in one thing. They don't even know where to start. They see the case and everything looks so complicated or so wrong that they don't even know what the right approach to start is. So occasionally, what it makes a complex case is actually not the treatment per se, it's the fact that the patient might be very young and the treatment might sound very invasive and comprehensive, and maybe some general dentists will not feel comfortable telling an 18-year-old patient that she needs crowns in all of her teeth. And the truth is that if your patient has a congenitally acquired condition, like this patient had, she had a condition called Amelogenesis Imperfecta. And what that means is that the enamel of your teeth is defective. And if you see here in the front, those white spots on the upper jaw, those are actually composite fillings that some dentists placed on this patient. But the modded teeth, all those mott's and white spots around the premolars, that is exactly how her teeth naturally look. So if you have imagined that you actually are born with this condition and these are your teeth, where could that put you psychologically and emotionally? Your teeth are sensitive all the time. You probably spend at least 12 visits a year at the dentist. So we're talking about a patient that is being at the dental chair for many, many hours in their whole life. So when somebody has received that type of care and what they need is crowns in all of the teeth because that could be the only solution, that is a complex case. And it's not a complex case related to the solution. It is a complex case because you are actually ensuring that that patient can minimize their dental needs in the next maybe 10, 15 years, because at some point in her life, she will have to redo that dentistry again. But the longer she waits to do the right thing, the less chances she will have to do so. So I believe that although some of these treatments can be invasive, it is a true service to the patient to give them something that for some can be life-changing. So we can actually successfully manage a complex situation as long as we have a structured thinking and a multidisciplinary approach. The case I showed you, like many of the other cases that I'm going to be showing you, are not done by one person. This really requires a teamwork. And I think that is the beauty of dental specialties, that we can completely address a patient care if we do have an accurate diagnosis and an integrated treatment altogether. So although there are many steps into identifying or managing a complex situation, I want to spend a little bit of time on the two that I consider the most important. And one, it's doing an accurate diagnosis. And then the second one would be visualizing the final outcome. And we're going to break it down and explain which one, which one of these is so important. Accurate diagnosis. When you're in dental school or when you start being exposed to dental education, you will understand many of these things about a dental diagnosis. Dental diagnosis includes diagnosis of caries, defective fillings, fractured teeth, endodontic or pulpar conditions, periodontal or soft tissue related conditions. So these are the things that any general dentist will be looking at in a patient. Very simple. You have a crown, then you have a chip, you have a broken tooth, maybe you need a crown. You're missing a tooth, you need an implant. That is the basic level. In prosthodontics, we actually look at what we call advanced findings. To any patient of mine, I'm going to make sure that I address other types of questions. Perhaps if my patient is a grinder or a bruxer. Why? Because that parafunctional habit might put any restoration that I put in the mouth under stress. If my patient is a gagger or he has an unusual tone, shape, or position. If that patient has dry mouth or takes any medication that actually makes the mouth more prompt for caries. If there is really a lot of defective restorations, if the bite type is complicated, if you have joint issues. So the type of questions that a prosthodontist will ask and the type of findings we will collect are a little bit more in depth. Why? Because most of the cases we're constructing is on a single tooth problem. It's typically a 12, 14, 24 tooth problem that all need to be addressed together. And then regarding visualizing the final outcome, I want you to have clear that the way how we manage these cases is by start understanding what are the specific issues. And I'm going to leave this picture here for a second because I want you to look at from just the basic perspective. What do you see? And you can probably type in the chat. What do you see on this picture? Okay, so we have grinded teeth, wore down teeth. Yes, it looks like baby teeth, right? So the front teeth are very small. What about the back teeth? Various size, yes. So the back teeth look probably normal size, right? And the front teeth look really wore down. Surprisingly, those are not baby teeth. They're actually adult teeth. So this patient has grown down their front teeth only, not on the back. So imagine now that you have to make those teeth longer. If you make those teeth longer, I guess my question will be, can you make them longer? If you really make them longer, you're going to open the bite in the back. So your back teeth are not going to touch. Why? Because right now these ones are touching edge to edge like that. If I just make them longer, which you can, then eventually the same thing can happen as well. Yes, that's right, Ron. So the same thing could happen as well. Patient could grind if we don't really identify what the problem initialized is. Excellent, Ethan. There will be a gap on the back teeth. So imagine that you have, I guess the next question I'm going to ask you is that what if I tell you that the position of those borders, and we'll call that border incisal edge. Excellent, Vinny, pushing the gums back. So I'm going to touch base on that in a second. But what I wanted you to think for a second, if I tell you that that border of the teeth, which we call incisal edge, is the correct one, the only solution for those teeth to be long again will be, instead of making them longer, pushing the gums up. And that is a procedure called crown lengthening. But even if you do that, those teeth will still need crowns or caps on top of them because they are not in the proper shape. So that is exactly what a complex case is. It's something that really has a lot of things to think and consider. But one way of making that thought process a little bit easier, and I always like diagrams to structure my thinking, is planning and visualizing on stages. Every time that you see a patient that is complex, your first stage in treatment is going to be a comprehensive evaluation. A comprehensive evaluation will be looking at all of the things. I want to know what my endodontist thinks about these teeth. I want to know what my periodontist thinks. So I will first do comprehensive consultation or interdisciplinary consultation with all of the other specialists that could play a role in that case. I will take a very, very detailed dental history. And I'm going to show you later, when I show you a case, what a detailed dental history looks like. And I'm going to do an evaluation that is aesthetic and also functional. When I say aesthetic, and I go back to the picture that I'm going to bring up in a second, that's what I asked you before. Are those teeth looking good? Probably not. They're too short. They're worn down. Those are all aesthetic evaluation. What is phonetic evaluation or functional evaluation? Can this patient talk with these teeth so worn down? Can this patient chew with these teeth so worn down? Justin is asking how you get the patient to stop grinding after treatment. And many times it requires changing the position of the teeth, because what it makes the teeth grind against each other is because they are in a position that is not functional. And many of these patients, to be honest with you, they need to use a mouth guard always afterwards, especially if they're night grinders. Most of the grinders, I will say close to 90% of the grinders are evening grinders, so nighttime grinders. Some people grind and clench during the day. That's related either to stress. Some people do it when they're working out or lifting. They tend to clench. So it is very important that all of the treatments that I will show you today will be married to a mouth guard afterwards, which is similar to a sport guard, but something that people will use at nighttime. So once I completed all my examination that involves looking at the teeth intraorally and also looking at the face, I want to know what is symmetrical on that person's face, because those teeth will belong to a face. I will also ask the patient what their chief complaint is, what their expectations are versus what their reality is. And if you are in social media, like all of us these days, and you'll see a lot of people getting maybe veneers in all the teeth and all these teeth that are like huge and big, and they might go to the dentist just because they want to have white, big teeth. That will be something that will exemplify need versus want. Do these people really need this work, or they just want it? And identifying that as a specialist is very important, because I will consider unethical doing a treatment on a patient just because they want, not something that they necessarily need. So once we collect all that information, we translate that information into wax. And why wax? We can do laboratory wax manually, or we do digital wax ups, and I'm going to show you later. But we translate those ideas and those desires in something that we can see. That way we start visualizing the outcome. What I mean is that I don't touch the patient yet. I will do everything I can to postpone the moment in which I touch the patient to the point that I'm 100% sure what that should look like. Because if not, it's like going somewhere without a map. Just get on the car and drive, and just start driving without a map. So I make sure my map is very clear and I have all my instructions aligned before even touching the teeth, and of course, before finalizing. So going back to the case that we just saw, visualizing the outcome will represent asking what is wrong in this mouth. And we said we identify specific issues. We talked about wore down teeth, etc. And now I want to see how to fix this. And for this scenario, we went in and we checked that actually the teeth were indeed short. Can you see my mouse marker there? Yeah, perfect. So they were short from here. So they needed to be longer. But as somebody mentioned in the chat, if I just make them longer, the back teeth will open. So we actually had to put the wax everywhere, in the front and in the back. In some cases, will be the other way around. We'll be cutting the gum, but this was not what was necessary for this particular patient. And we'll talk about the most invasive procedure, because depending on what you will consider invasive, this could be considered invasive if I tell you that this patient will need crowns in all of their teeth. But to me, it is invasive that somebody comes with all their teeth worn down to the point that they will need to extract. So to me, it will be more invasive to leave this person walking until they basically need to get all their teeth extracted. So what you see on the second picture is the wax in white. Then the wax is translated into a material that in this case is acrylic. This is a third picture, into something that we can try in the patient mouth. So what you see in the first picture on the lower left is this same acrylic snapped in the mouth. So I haven't yet touched any tooth. And with this situation, we test. We test function, we test aesthetics, we make sure the patient likes it, we make sure the patient can eat, can talk, everything. Once this is approved and okay, we move on comparing that with the professionals, which is the picture on the lower middle. And these are temporary crowns. And the temporary crowns allowed us to then do the underlying work. If this patient needs a root canal, I can take the temporaries out, send it for the root canal, and put the temporaries back in. If this patient happened to need an extraction, which was not the case, but if they need an extraction, I'll take the temporary out, they get the tooth out, temporary goes back in. So the patient always go home with teeth. So the temporary is actually a duplicate of the final, but in a temporary material, so we can do the foundation work. And then the final picture that you see is the final restoration. So I'm going to show you some more cases. And before we do that, I will probably ask you to complete, let me see if we're ready for poll number 2. Don't post it yet, Nina. I'm going to go on a second. And I think we are, yes, let's go with poll number 2. Super. And we talked about identifying what a complex case is. And I want you to tell me what you think is the most important step.
Alrighty, with 80% voted, I'm going to give a couple more seconds. If you have not yet turned in your vote, go ahead and do so. All right, and I'm ending it. Take a look around the room.
Excellent. I love you all. That is exactly what it is, an accurate diagnosis, the most and single most important step. I'm going to show you more cases, and I keep looking at the chat. So Aster, I'll answer your questions later, and I'll make sure we get through all the questions, okay? But I want to talk to you about this patient. This patient presented to me really concerned about her front teeth. She was seeing a dentist on a regular basis for 20 years, and she's a community DJ. So for her, talking and the way how she looked was really important, because although she was not on TV, she was on the radio. So she needed her voice to always sound like it should. And she was worried that in the last few years, that has not been the case. When asking her really the reason, she said like most of her front teeth have been walking out, that her dentist like about 10 years ago or so really didn't know what to do, and they decided to splint. What splint means is joining the teeth with either wires or composite, whatever. So you can see here in the clear picture in the background, like the little wires that are remaining. Some of them actually have come out because she actually had a lot more. And you can see all of the composites like basically joining the teeth together, kind of like to prevent them from moving because they were moving forward. So she was kind of tired of that situation, and she felt that that was really affecting her speech. And I want you to think about it for a second, how the front teeth relate to your speech. If I ask you to pronounce 59 or count from 50 to 59, you will notice how the incisal edge, which is the border of the teeth, touches the lower lip softly. That is called phonetic evaluation. The tongue also plays a role, Ron, so that actually also helps with phonation, but particularly the position of the incisal edge of the maxillary anterior teeth against the lip plays a role in phonetics, especially in the phonetics of the labiodental sounds. We call that labiodental sounds. So I realized that these teeth were too far out. It was being difficult for her to pronounce some words, and she was sounding funny. But I still was curious because I said, you know, this person has been a dentist for 20 years. This is not neglection of dental care. This is just somebody that probably was not seeing the proper person, or just that the person she was seeing did not have the proper answers for her. So when I go and get dental history, I ask all of the dental records. I really want to know everything that happened in those 20 years. Why? Because if I only see that window of time in which she sees me, I might say, oh, this looks horrible and terrible, but maybe she's been maintaining that condition exactly identical for 20 years. And if that's the case, I'm going to be less aggressive because I feel that things are pretty stable. But if I see that in the past 5 years, things have been deteriorated deeply, then I'm going to start thinking more aggressively and so on. So that is why it's so important that you know the history, medical and dental history of the patient. So I noticed that she switched dentists a couple of times in those 20 years, but always went back to the same. And she had a lot of issues with a bridge on the upper left side. So I'm going to show you a panoramic X-ray, which is basically an X-ray of all of the teeth together. And on the left side, you see the L on the lower right side of your screen. This area over here, these are two teeth that were holding a bridge. And at the time she came to me, there was no bridge anymore. She said that that bridge came out too many times. I didn't even bother going back. But believe me, again, this was not her chief complaint. Her chief complaint was my front teeth, I cannot speak, I'm a DJ, blah, blah, blah. So I started thinking, if I only focus on the front teeth and I provide a solution for the front teeth, how can I guarantee that the teeth are not going to continue to move? There is an underlying problem here. So going more in detail on trying to collect a proper dental history and dental records and getting the adequate diagnosis, I realized that she had some functional issues, and we have some devices in prosthodontics that we use to trace how the jaw moves. So we did mandibular jaw tracking device. We use other types of devices that help us seeing the health of the joints. We actually diagnosed her with some T&J issues as well that she did not know. And the reality was that unless we address that this was a current condition, anything that I put on those teeth, they're going to continue to flare. And I just want to show you this lateral picture for a second, because remember I showed you the bridge on the X-ray. This area over here on your right side of the screen, that's where the bridge was. Right now, those teeth that are prepped, so they're shorter, are almost touching. Actually, they were touching the bottom teeth. So how do you think there was ever a bridge here? Any comments? Maybe on the chat, what do you think it had happened with those teeth? That before there were caps on top and now there's no room for caps anymore. Any idea? Maybe people are typing a long idea. But if not, I'm going to disclose some possibilities. They were growing down. The thing is that when you remove something, what keeps the teeth in position is the contacts with each other. If I remove a tooth in between, the next one is going to tilt towards the space. If I remove a tooth from the top or from the bottom, the top tooth is going to come down. So what really keeps the teeth in position is a contact with each other. As soon as you remove something, the teeth start moving because they need that contact to have a stable occlusion or a stable bite. At the moment that you start losing the bridge, those teeth start drifting down or over erupting to the point that she got a contact. That is one possibility. There are other possibilities. And I want you to think now about the jaw and the mandible as one bone. That is very unique because you have two joints held by one bone. So if you have joint issues in one joint, think about your hips. If you have hip issues in the right hip, will your left hip be healthy? Maybe at the beginning it was, but at some point from limping, it's going to be affected as well. So when we have joint issues in one side of the jaw only, eventually the other side suffers as well. So for her, she had a combination of joint issues in one side, which were making her jaw shift, and also a rupturing of the teeth. And add pressure on the other joint, absolutely. That's exactly what it was the case for her. So we needed to change the treatment position, and I'm not going to get into much detail, but remember we talked about visualizing and planning. Now I need to visualize how I want this to look, where I want those front teeth to be. And I told you they were far out. And what I'm going to show you here, you can see the yellow portion of the stone represents where the teeth were before. So they were not only shorter, but they were out. So I brought them in and made them longer so she could have a proper function and a proper sound. Once that was okay, we tried that in the mouth and we made her provisionals. And these were her temporary crowns. And I made sure she was able to function properly with those before we move on into anything else. But you might be wondering what is holding this. And I'm going to show you now underneath how those teeth look like after preparations. And this is how they look like. So you prepare the teeth for caps, and some of them you will see gold because they're actually implants or teeth that have root canals. So we have different types of post holding this structure. We take a final impression or a mold of these teeth, which is by far, I think I got a question of the hardest thing. And the hardest thing in prosthodontics is actually capturing an impression like this, in which you can get all 14 teeth at one shot. And for some of you that had impressions, you know it's not a really pleasant thing for a patient to do. I know, right, Hannah? So what I want to show you here is the transition. You have the initial condition on the left side, then you have provisionals, then you have your final preparations with including implants on the teeth missing and the ones that needed to be extracted. So the gold ones are implants, and then the final crowns. So if I only ask you to look the first line of pictures and the last line of pictures, that will be, this is how the patient came, this is how the patient left. And with prosthodontics and what we call a full mouth reconstruction, we really can get the patient to be where they were at some point in the past, or sometimes better, really depending on what their starting position or what the starting condition is. And this is how a full mouth reconstruction will look from the lateral view. And the time that it takes, it varies. In a private practice setting, this could be a year, maybe 8 months, if they don't need too many surgical procedures. But if they need a lot of surgery, it could even be up to 2 years, because some surgical procedures take up to 6 months of healing. So it doesn't mean that in that year, the patient will have to come too often, but we're talking about easily 12 to 14 visits to go from what I show you to the final. Thank you for that question, Astor. So now I show you the final X-ray. This is what that reconstruction will look like. You'll see some root canals, some implants, some crowns. And like I always said, the most important thing is addressing the patient's chief complaint if what they are looking to get is what they need to get. And for this patient, which was her front teeth, the way how she looked, and the function and talking, this was able to address all of those concerns. And the care that they receive afterwards, to Vanessa's question, this patient is put on a recare of being seen cleanings, just like any of you every 6 months, and they come and see us once a year. This patient also got a mouth guard, so we make sure that we can control everything so she doesn't grind or breaks anything afterwards. And adjusting to their new lifestyle, that's an interesting question, Jasmine, because most people actually see a benefit. Their lifestyle have been deteriorated for so long that the teeth became the center of their life for so long before they come and see me. All they have been doing is thinking about how bad the teeth look. They're self-conscious about it. Imagine her, she was nerve-wracking that she would, like, one of the teeth will fall out because the teeth were moving. So for her, it was a natural adjustment. But remember, this patient is in provisional for the most long of the treatment, the monthly length. So they have time to adapt into the prosthesis, because if I tell you it lasts a year, out of that year, 8 months they're using provisionals. So for 8 months, they're wearing something that replicates the final in a temporary material. So if there is any problem with adaptation, we have all of the time to fix it before we finalize. And this work tend to last, to Reem's question, a crown has been documented on the literature to last without a problem anywhere between 10 to 12 years, which doesn't mean that after 10 to 12 years, they have to redo the whole thing. After that amount of time, you start seeing complications. And the number one complication for this patient is decay. So if they go to their clinics and they come to a recare, typically we can keep decay under control, because along with the maintenance, we give them a special toothpaste that have high fluoride content, that is a prescribed toothpaste, so they can keep their hygiene longer. So those are all wonderful questions. And I'm sorry, I'm not leaving them for last, but I feel like they're pertinent to the cases. And before we go to case 2, can we not launch the next poll? And I hope this makes sense now, because I told you already what the incisal edge was, which is the border of the teeth. And we talked about sounds. We also talked about smile. I'm telling you the answer already. I'm cheating. X. Oh, I'm loving you guys. You're killing it. I feel like there are more dental students here than what you're really confessing they are. I'm going to show you a very different case now. This is going to be closer to us. This patient was only 28 years old when he came. And we talked about younger patients before. So for this particular patient, it was very different because he had a medical condition that made him very prone for caries. So he took medications that will make his mouth dry. His overall health was not the best. However, he was super smart. He is super smart. And he was one of my residents' case. And he was really committed to do something to address his health. And he saw other people, and he was told you had to remove all your teeth and do implants or dentures or whatever. So he looked for a second opinion, and we come up with a couple of different options that you will see in a minute. But for here, we're looking at, again, a lot of decay. The teeth are really worn down as well. We did not have that much space. I'm not going to go into much details of this, but what I want you to see is that this patient, again, this is not neglection of dental care. Look at all the fillings. Everything that you see in white is either a filling or a crown. So this patient also spent a lot of time in dental chair. Yet, once we identify which teeth need to go and which teeth can stay, which we do later, we treat everything exactly the same way. Visualize the final outcome first. So we take wax and we design ideal scenarios with wax. And then from that, we convert into provisionals. Remember I told you we put the temporaries, and if you need surgery, if you need root canals, we can take the temporaries out, do the surgery, and put the temporaries back in. This is exactly what we did for this patient. Because he needed few extractions, these are the teeth prepped. We had the temps already, so we were able to take the temps out. He had the surgeries that he needed, got the teeth pulled that he needed, and went home with his temporary teeth. So he was never missing a tooth, which is super good for a 20-year-old guy that is looking for a job or studying and still can really continue with their life, even though they're undergoing major dental care. For this patient, we combine also with technology. So we plan for guided surgery for the implant placement. So what you see in gray is the clinical condition of the CT scan. Then we superimpose in blue with impression. And then we superimpose in orange or yellow for the teeth wax up that I showed you before. And we digitally planning the surgery for the 6 implants he needed, 3 on each side, so we could really give him a full set of teeth like he had before. We planned our guide for surgery, and we did this guided fully, so our residents are able to do their surgeries along with the prosthetics as well. So we were able to place all 6 implants with bone graft, and this is basically one side. And what you see on the other side, and I'm sorry if these are sensitive pictures for some, but he was able to go home with the implants placed, all 6 at once, and with later on, once the implants heal, provisional crowns that were held on the implants. So what you see here is temporary. This is all temporary crowns. And you see on the upper left, I have here this post sticking out. These are replicas of the implants, and this is how we connect the provisionals on the implants. So he was able to get a replica of the final restoration and a temporary material until everything healed. Once everything healed, this is what it looked like underneath. And we were able to make final impressions just as before, and then it started becoming repetitive. And we were able to fabricate crowns that we will test for same thing. Phonetics, if the patient can talk well, aesthetics, and see if the patient can function. Once the patient approved, this is what the case looked like. So remember how he came at the beginning with all those cavities and all those issues. Yes, this can potentially be a stressful and long procedure, but for somebody that has been on the dental chair so long, this is basically restarting his dental life. Now he can go to clinics like a normal person every 6 months, twice a year, follow-ups with us once a year. And if he can maintain, maybe in 10, 12 years, he needs 1 crown replacement, 2 crowns replacement, but it becomes simple dentistry. Any dentist can do that. So this is the final outcome, the frontal view and the lateral view. And if you just see him, you wouldn't even know these are all crowns. He really looked very natural. And this is what the X-ray looked like with all of the implants. I show you how we place. And of course, because everybody loves before and after, this is how he looked. And for choosing the color of the teeth, that's a question that has been asked a couple of times. Typically, the patient participates in the color selection. So most patients, younger patients especially, they like whiter teeth. But to be honest, that's also cultural. In Latin America, I use always a shade of color that was a little bit darker. Here, everybody likes like white, like paper white color teeth, at least in the New England area. If you're in California, even more. So it depends on where you are. I always set like the input of the patient for selecting the shade. Next case. This is extremely different now. Now I'm showing you somebody that has no teeth that can be kept. Everything is decay, heavily decay. From the clinical point to the X-rays, it's really complicated. So for this patient, we cannot save any tooth. Therefore, we have to extract everything. And these are temporary dentures. So these are sets of teeth that teeth have been removed because none of those teeth could be kept. And I'm going to show you what surgically or what type of surgical treatment we can do for somebody that loses all of their teeth. Very similar. This is like the wax up that I showed you before. This is visualizing the final outcome. This is how I want his final teeth to be, how I want them to look and smile. And now we scan that and we superimpose with a CBCT scan, and then we start planning a surgery. We will place 6 implants on this patient. And this, we basically look at all the anatomical landmarks, we trace the nerve, we plan every implant to have proper bone all around. And I'm gonna show you hardcore prosthodontics, very high complicated type of cases, because this patient had too much bone, so he needed to have a complex type of guide. And if I just show you all these pictures, just remember, this is a puzzle. These are pieces that go one on top of each other, and I'm about to show you a video for you to understand what all of these pictures mean. We basically call this stackable guides. One snaps on top of the other. So the patient can come without teeth, and they can go home with implants and teeth in the same appointment. And these guides allowed us to do that. So this is a patient, no teeth. All the teeth were extracted, but he has a lot of bone. So we have to cut bone and plan for the implants and give him teeth all in one visit. So for those that are sensitive, some videos are coming, so sorry about that. We placed the first guide that we used to cut the bone because there was too much bone on this patient in particular. And then in that same guide, you can see the pins sticking out, like there's gold pins with a circle around here. Every guide that goes on top snaps on those pins. So that allows us to put the guides in and out without anything moving. Because if not, it's not precise. If not, we cannot do guided surgery. So I have a quick video that I'm not gonna play completely, but I just wanna show you kind of like how we snap in the guide and we make sure it's stable. And once it's stable, we proceed with our implant placement. And what the implant placement is basically drilling. So we drill through the holes one by one, And these drills have different diameters, so they widen the bone until we get to the size of the implant, because the implant is like a screw that goes inside the mouth. And I'm going to fast forward this because basically this goes the same for all of the 6 implants. And then after, you see that that's the implant. So once we drill everything, we come in and we place the implant, and everything is through the guide. So all we need to do is follow steps 1, 2, 3 in order. And this gives the perfect implant position for teeth to happen afterwards. So once we remove the guide, I'm going to move forward a little bit. We place all the 6 implants, and now we want the patient to have teeth, right? So we come in and we snap in the teeth guide, and we want those teeth now to be connected to the implants so the patient can take them home. And these treatments mostly are done under local anesthetics. For those asking for anesthesiologists, some patients request doing full anesthesia, but most people with local anesthetics they can take. And actually, we need the patients awake at least at the end of treatment because we need to check the bite. If the patient is not awake, we cannot fully check the bite. So we could use some anesthesia or some sedation for some part of the procedure, but for the most part, with local anesthetics, people are holding well. And yes, we are customizing all these guys based on the tooth position because those pins, those implants need to be placed according to where the teeth are. And the teeth are going to be in a different position for everyone. So these are the pins sticking out. So we connect those. And I'm going to fast forward this video because in benefit of time, what I will show you is that then we basically have the temporary teeth. And these teeth are screwed in to the implants that the patient just had recently placed. So it becomes like a surgical cast, but with the shape of teeth. So the patient can go home, they can chew with this, they can eat, no problem. The patient tongue always gets in the way. Vanessa, no way, who else? FF, it always gets in the tongue. There is no way of managing the tongue. You tell the patient, don't move your tongue and they move it even more. So that is a challenge. So that's good. That's why we do these surgeries four-handed. So we need an assistant that helps us control not only the patient tongue, but also retracting. And then this is basically the X-ray of all of the 6 implants in place. And before I go, actually, let's launch poll number 5. And I'm going to answer Vanessa's question in the meantime. How many specialists could be working on one patient at once? But let's go on the question first. We talked about complex prosthodontic case and what is the most important thing one should be able to do. And specialists, it depends on the case, Vanessa. For the most part, a very complex case can have up to 5 specialists. You can have an endodontist, an orthodontist, prosthodontics, periodontics, and oral surgeon. So that will be the max that will be involved in one case. But many times you need more than one of each. So you might need more than one surgeon if a case is really complicated. But for the most part, between 2 to 3 will be the average. And of course, there could be complications with the healing process, as just Lynn said. The complications rate, and for patients perhaps that are smokers, the complication rate with implants and surgeries is higher, like with any surgical procedures for smokers. So there are different rates of complication, but for the most part, the complication rate is between 5%, so it's very low. So success rate and no complication rate is really high. And I will show you what's the youngest patient I had. Shailas, we'll see it coming up actually. Maybe we can close the poll number 5 and let's see what people thought about visualizing the final outcome. Absolutely. You should be able to always visualize the final outcome. And I'm going to show you my youngest patient soon. Actually, my youngest patient is the one with the blue hoodie there, because prosthodontics is also about congenitally inherited issues. And we work together with Tufts Medical Center and ENT, cleft and palate team. And this is Dr. Morgan, who is a maxillofacial prosthodontics. And we see patients to which plastic surgery can no longer help. Imagine you're born with one ear. A plastic surgeon cannot rebuild you another ear. That is why prosthetics is into play. So with prosthetics and technology, for a patient that was born with only one ear, we were able to fabricate a prosthetic ear. And something that is really cool with the use of technology is that back in the time when I did residency, we will do these wax ups by hand. What you see at the bottom of the screen is basically 1, 2, and 3 different wax patterns that my classmates and I did. Mine was this. These were 2 of my other classmates, but it took us, I'm telling you, like 6 weeks to get these wax. And yet none of these 3 ears were good for this patient. I'm telling you, they were horrible. But you see in white is what technology has given us. We were able to facial scan this patient and do a flip mirror of the other opposite ear, and then mill a cast that will help us fabricate a model to have these silicone ears be made. And these are attached by implants for those of you that are curious. But of course, this is a patient growing. So he will need an ear in another maybe year or 2 years, depending on how quick he grows. So we need technology that makes this thing easy and accessible. And this is actually 3D printed. So the one that is in white Kamal was 3D printed, but the fabrication of the ear per se, because we cannot 3D print yet silicone, it's made in like in acrylic made, and that with that we make a mold for fabrication of silicone prostheses. And moving along, of course, if I just show you now and this patient just shows up to you, you wouldn't even tell this is a prosthetic ear. But many times it's not only a patient that is congenitally missing a part. It could also be a patient that has cancer or a carcinoma that is very invasive. We were lucky enough to get this patient right before she had surgery. They sent it to us so we could do, they knew that we were doing facial scanners for these patients. They didn't know why or what for, but they said, oh, we have this patient, she's scheduled for surgery tomorrow. Maybe you want to do one of your things. So luckily we got her the day before. We scanned her and we were able to get a cast of her nose. Of course, he had the defect already, but what I want to show you in the upper left is that we covered the defect with wax. So we patched that and we were able to get a cast that looked like her ear, her own nose. Later on, when she had surgery, she looked like this. So we were able to superimpose her surgical condition or post-surgical condition with her existing nose and mill a cast of her nose. And for her, it was the whole difference in the world because she walked away, yes, with a defect that will make it very difficult for her socially to even integrate. Everybody will look at her, but at least she was able to get a prosthesis that made her feel normal and make her feel herself. And that's part of the beauty of prosthodontics. And with that, I guess I'm going to post poll number 6 before we move on. If Nina or anyone in the team can help us with that. For these cases, actually plastic surgery, Millie can no longer do anything because imagine you have a defect, a hole like this. There is not enough cartilage that they can harvest or get to reconstruct. So we do work together with a team from the ENT. So we work together with plastic surgeons, anaplastologists, and different types of medical professionals. So all of these patients are carrying teamwork. However, when they get to this point, the only solution is prosthetics. And we talked about aesthetic evaluation and functional evaluation. And I probably did not specify much about vertical dimension or rest space because we just went too fast. But I will, that's fine. I can tell you the answer of this because I cheat. I didn't tell you all the details about this poll. So the answer for functional evaluation will be, take a guess, and then I'll tell you. All of the above. Good. Good guess. That's exactly what it is. It looked complex enough, right? So moving on, because we're reaching the end, I just want to close by telling you that in anything that you do professionally, it's very important that you have a goal. My goal, and that's why I stay in academia, was to make information accessible for all. And I love this project with pre-health shadowing. And the reason why I love it is because I think mentorship is one of the things that has impacted my career, positively impacted my career the most. And I also wanted to make mentorship available for people. And I felt that as an international dentist and somebody coming from abroad, when I came here, I didn't know anyone. Not only I'm first generation dentist in my country, I had nobody in the US. So I decided to create a podcast over quarantine, like all of our little projects. And I created this, the International Dentist Podcast, on which I have interviews of different dentists coming from all over the world and sharing their experiences on the dental field. I don't only share with prosthodontics, I have endodontists, I have oral surgeons, I have dental radiologists, periodontists, so people in all of the dental field from all different schools across the country share their experiences with me over maybe an hour or less conversation. My podcast is available on my website, theinternationaldentist.com, or you can find me also on Spotify, on Apple Podcasts, and of course it's free like any podcast. So maybe if any of these stories impacts you, or if you want to learn more from these people, that some of them are in private practice, some of them are in academia, I have some deans. So I really get a collection of professionals that are all in line with this mission of sharing. So I cannot tell you how important it is that you build your career around mentors, because your mentors become your friends and your friends become your life. So with that, I'm going to reach some conclusions. And if you're curious whether prosthodontics is for you, dentistry is for you, or academia is for you, I will give you some take-home messages. Find a mentor. That's number one, if not number 0. Maybe shadow some prosthodontics on a private practice, or if you're in a school that there is a prosthodontic program, shadow there. So any dental shadowing that you can do in the clinic will be very helpful. Every specialty has college, and the American College of Prosthodontics, which I'm a member of the Massachusetts board, also has opportunities, events that are regional and national events, and they always sponsor students to participate. If you can get involved in research projects related with prosthodontics, that's fantastic. Take advantage of any opportunity of networking. So I love that networking activity that you guys are going to host, because the more people you know, the more experiences you can hear, and the better informed you're going to be up to taking your decisions. So be part of any study club or organization you can. Do a self-assessment. And I think this is very difficult, because you need to be honest with yourself and understand what your weakness and strengths are. And of course, I want you to work on your weakness. We all have been told that. But the truth is that the way how you're going to go farther is by leveraging your strengths. Understand your strengths. And yes, work on your weakness, because you need to improve anyways, you will. But are your strengths the ones that are going to take you farther? So realize what your strengths are. Let's say that you have great hand skills. You're fantastic at painting. Whatever it is, that's your skill. Try to relate that to whatever you're doing. Maybe your skill is social and you're just a fantastic talker and you connect with people very well. So try to find career options that give you an opportunity to talk. If you're a great talker and you're a people's person, you're not going to be a researcher that is going to stay in the lab, not talking to anyone, and so on. Explore student organizations. American Dental Association, the American Education Dental Association are great places for you guys to find resources available for pre-dentals and dental students. Get involved whenever you can, volunteer for events, do teaching assistant, and practice your skills. So if you ever want to get into wax, actually I start practicing before I got into dentistry. I'll take a soap bar and I'll carve on the soap bars. So try maybe carving some soap bars here and there and see how that goes. Might be chaos, but it might be fun. And just to close, and because I do believe it's very important that you follow your guts and your passion, find your passion. Because if you find your passion, you will identify what you're great at, and hopefully that will be what the world needs and you will succeed. I can guarantee you that. So with that, I'm open to entertain any questions. And I'll invite you one more time to my website and my podcast if you would like to hear more about other dental experiences. And once again, thank you all for this opportunity.
Thank you so much for this wonderful presentation. This was amazing. So to get started with the questions, the first question we have is, what is the most invasive procedure you have had to perform?
That's an interesting question. Is it okay if I just close the screen so we can see more faces? Super. Probably the most invasive procedure will be anything done in a young patient. And that relates to the age of my youngest patient. Some of those patients that have anomalies that are congenital, we need to treat them very early as 3 years old. For prosthetics, specifically, the most invasive procedure will be a full mouth implants, all of the teeth extracted, but basically from somebody that comes with teeth. So those are potentially some of the most invasive procedures that we do in our specialty.
That's interesting. Thank you. The next question is, what made you decide to work in dentistry versus other healthcare professions?
I wanted to be a doctor, to be honest, for a while. I think growing up, I was so sure I wanted to be a medical doctor. And then for whatever reason, I wanted to be a nutritionist. Like I switched around medical field for a while. The reason why I chose dentistry among all of that at the end was because how I visualized my career to be. I wanted to be an independent professional. And I knew that as a medical doctor, I will always be related to either rotations or evening shifts or hospitals or certain things that, to be honest, I wasn't ready to commit. Maybe now it will be different, but at that time I wanted to be independent, have my own business, also have a family. So being more maybe in charge of my time. So I felt a career in dentistry could afford me that life. And it surely have. So I haven't regretted a thing. I think that a career in dentistry can give you that and more, especially as a female. And I see a lot of females in the room. If you are thinking that you need a career that allows you also a career life balance, I think dentistry can give you that.
That's great advice. Thank you. The next question was asked by a student. It says, as someone who's looking at dental schools abroad, what advice can you give? And was it hard adjusting to a new culture?
The adjusting to the new culture, I'm going to answer that first. It was not as hard in Massachusetts, especially in Boston. There are so many international students and Tufts particularly is a fantastic institution for that end. We were so many international that there was no longer a culture. It was like everyone's culture. Then the outside world, after I graduated and I started integrating myself into the real life, I learned, and it's very different to the Latin American culture for sure. But like everything in life, you adjust. In terms of identifying dental schools, when I was looking to apply for specialty programs, I went to the places. And I feel that's probably a hardship of now that we can't visit in person, because I'm a very intuitive person myself. I feel like if I'm in the place and I feel the vibe of a place, if it's the right place or not, I will know. So I only applied to schools that I could see myself in. Because at the end, you're also making an investment. This is an investment in time and money. And I want you guys to think you are the customer. For any school, you are the customer. So yes, it's competitive. You don't know which school are you going to get in. You have to apply to a few. You have to have your options. But I do recommend that you have a selection criteria for your options. Don't apply to places that you're going to be miserable. Don't apply to places that you don't share culture. If perhaps for me, as an international student, I wouldn't go to a small place where I will think that somebody from abroad will be point or target. I wanted to be in a place that I would feel is an inclusive institution in a city where being international was normal. So try to have a selection criteria, whatever it is important for you, try to have that clear. And align with that, pick up schools that have a mission and vision that aligns with yours. And you will be able to come up with enough so you can be competitive. But if you follow that, you're going to follow your heart. And I think the heart is always right.
Definitely. The next question is, what's the most challenging part about your work?
Dealing with everything that is so different. I guess we all deal with things that are different and whatever, but to me, I will just tell you a little bit. I see patients and also I deal with students, dental students. I also deal with specialty residents. I deal with both type of patients, the resident patients and the dental student patients. I'm also involved with organized dentistry. So I hold some positions in some organizations. So I think just managing all and understanding that every part of that will need a different part of you is what it takes the longest, because you need to give what the other one needs, not what you want to give. I need to give my residents what they need. which is not the same that my dental students need. Definitely not the same what my patients need in private practice. So understanding that you need to give for the other and changing constantly, because in a day I could play 3 roles. So I think that's probably the hardest part of my job, but to be honest, is the one that I like the most. I wouldn't picture myself just in a room, just doing the same thing all over all day long. That would drive me crazy. So to me, with my personality, that aligns very well. So that's why I'm always doing more and joining activities like this and trying to get involved with things, because I do enjoy that. That's why it's super important that you identify what resonates with you. If you do that, then even if it's hard, you're going to get through it.
That's
and
wonderful.
I'm too philosophical, so I'm sorry, I'm too philosophical sometimes.
Not at all. That's amazing advice. Thank you. The next question is, how well would you say dental school prepared you for your first patient?
Fairly good. I'll say that I had, and this, I'm going to make a disclaimer. Dental school in Venezuela might be slightly different than dental school in the US. The main difference that I acknowledge between the two is the knowledge of basic science. We didn't have that much basic science, but we had a lot of clinical training because we had an extra year. So that extra year did make a difference into how skillful we were when we graduated. I felt like I could treat patients very easily, especially simple patients. I had no problem. And I also learned how to develop a lot of patient skills, which I think it's very important to any health professional. Being an attentive listener, asking open-ended questions, certain things for communication with patients that could really take you very far, and they're very simple to learn. For that, dental school prepared me very well. What dental school did not prepare me for was to run a business, how to be a successful dentist, or how to identify what opportunities were right or wrong for me, or even, I don't know, I think dental school can teach you a lot of things, but not all of them. And that's okay, because maybe you don't need to learn all of them, because not all of them are for you. But things that I wish that I learned in dental school were more like related to how to even handle a practice or how to manage difficult patients. But I understand now that even though I wish I learned that in dental school, I was not ready. I did not have the base knowledge enough to even understand if I received the information. So in a way, I'm not sorry that I did not get that knowledge, because eventually I gained it through other experiences, and I was ready to learn that at that moment that I got it.
Definitely. Thank you.
Oh, sorry. Is it okay if I ask a question? Just
yes.
live?
Go ahead.
All right. So thanks for sharing this, by the way, Gabriela. So I know it takes, sometimes multiple months or even years to treat certain patients in your profession, but could you describe your daily life, like what you do every day for the most part?
Excellent. So I work 4 days a week because I like long weekends. So I make sure that all of my weekends are long whenever possible. And so in my 4 days a week, I work long hours. So I go to Tufts from 8:30 a.m. to 7 p.m. 2 days a week, and from 8:30 a.m. to 4, 2 days a week. So I'll say 2 long days, 2 very, very long days, and 2 normal days. In my very long days, I'm going to describe what that looks like. So maybe in the morning, I'll see patients from my faculty practice, and that could be all type of procedures. So if I start at 8:30, from 8:30 to noon, I might see 3 patients, depending on how complex the treatments are, because for the most part, I will keep my patients in for about an hour. Then maybe have meetings at noon, because I'm not a lunch person, so I'll just grab whatever and have meetings at noon. And then I go on the residency clinic in the afternoon. So what I do in the residency clinic, for the most part, is supervising these type of cases in the clinic. So we do surgery, we do comprehensive preps and temps. Maybe I help them in the lab. So I'm with them for the remainder of the day. So from 1 o'clock till 7, I will be with the residents in the various activities. Sometimes I teach lectures, depending on what it is. So I do a lot of lectures like this. And now, of course, we do on Zoom. So it varies. I do a lot of interdisciplinary consults with people. So in between the day, I have meetings here and there. So every day is very dynamic, but for the most part, I do have that structure, especially on the long days. But I keep my day off in the week that I like to construct for my personal projects. So although, yes, I'm a dentist, I like to do other things like the podcast and things like that. So I make sure that I have a schedule that allows me to explore my other areas of curiosity, which I think in dentistry, you can build yourself that type of schedule. I hope I answer your question, Ethan.
Oh, yes. Awesome. Perfect. Thanks.
Sure.
Thank you. The next question is, how are you able to manage your work-life balance?
I mean, during residency, I have no work-life balance. I'm not gonna lie to you. Residency was the most unbalanced experience of my life. I had to recover my health after all. It took me a good year to recover my sleep afterwards because I was in the overload of work of a resident in our specialty. I show you type of the cases we have. Imagine that multiplied by 30. Imagine you have 30 ongoing cases like that. These patients are paying also big amount of money for this care, by the way. This type of treatment could be anywhere between $40,000 to $70,000. So we're talking about big commitment, and it carries on your shoulder. You're not making any money, you're learning from it, but yet the patient demands like a patient will demand for a service. So it is very stressful. So you have your clinic hours, and your clinic hours run same thing from 9 to 7, but you also have classes. So you'll start your classes at 8, and sometimes you have classes after 7. So days were very long during residency. With that being said, I didn't get that much sleep in those 3 years. I don't regret. I'll do it again if it was free, but maybe with some more balance. Yet after I graduated, I realized that was not all about life. And I feel like when you go to school, I told you I did 5 years of dental school, then 4 years of specialty with like a year or so in between of work. When you go 10 years of school, you forget what balance is. You're just being a student for so long that you don't even know anymore what a balanced life is. So of course, like getting in the shower, you open out too cold or too hot, like until you get the perfect temperature. In residency, I was definitely too cold. And then I graduated from residency and I went to the other extreme. So I'm like, I don't want to do anything professionally. So I took a year off, on which, yes, I was working, but I didn't do anything else other than go to my work schedule, and that's it. So no extra activities, no involvement. I was tired. I needed to work, I needed a salary, but I was tired. So I'm just telling you this story because finding that work-life balance is a dynamic situation. So you might have it for a while, then you lose it. And balance might look very different for every person. For some person, the balance is daily. Like I need to get my exercise every day, so it keeps me sane, so then I can work. So maybe the balance is in a day. To me, I'm more like a seasonal person. So some seasons for me are super hard work and some others are restful. And I continue to work, but my workload fluctuates with the seasons because that's what works best for me. Why? Because I'm a slow starter. So that's, again, knowing yourself. For me to get like in the rhythm of being super productive, I cannot go from 0 to 100. I have to build. So because it takes me a while to build, once I build, I want endurance for as long as I can keep, just like exercise. And then when I hit the point like I cannot keep going, then I slow down. So that for me might represent that I had 3 super productive, for the most part, it's about 3 months. I have 3 good months of the year. Then I have like a lazy month. Then I have another 3 lazy months and so on. So that's how I personally found work and life balance. But I encourage you to find what works best for you, because at the end you need to be happy. And I have friends that represents that is daily. They need to have their daily thing. I could go on working nonstop for 3 months easily, but I'm not that normal. So you've seen that already by my cases. So.
Thank you. The next question is, what did you do prior to going to dental school to make your application stand out?
Very good question. I'm going to refer to this question based on what I've seen of my students, because in dental school in Venezuela, it's not as competitive as here in terms of extracurricular activities. We only have like a national exam, and the national exam is extremely competitive. So the only thing I needed to do in Venezuela to get into dental school was score very high on this national exam. So there were around 17,000 applications for 500 positions. So all I needed to do is be on those 500. And I took a year off of studying for that exam so I could score in. And I was able to do that, then fine. But here is a completely different ballgame. Here for dental school, you need to have your application stand out from the rest because you have a lot of competition, which is a different type of competition because they're looking at multiple aspects. So things that I've noticed that are very helpful for a student here in terms of making their application stronger is all of the amount of extracurricular activities that you can do. And it has to be constructive. Activities like this, virtual shadowing, real shadowing, research. Some people like getting a master so they can be a little bit more competitive. I think there are really many things, volunteering in organizations. Part of it is making sure that you can make your application stand up enough so you can get an interview. Because I'm sure if you get an interview, then you're going to have an opportunity to talk. And you will have to prepare yourself for the interview, of course. And that could play both ways. For somebody that feels comfortable talking, that is a great thing. Oh, I have an interview, now I can prepare. For some others that are more shy or introverted, think, oh, freaking out, I have an interview. Make sure that you make your application show who you are or who you are intended to be. And also have a personal statement that reflects you. People try to fit a mold. And if you could walk out of here, forget about prosthodontics, one advice, do not fit on any mold. There is only one you. Try to make sure that you leverage your strength, and your strength is your uniqueness. And when we are doing interviews, I'm telling you because I participate from interviews, we want to see who the real you is. We can tell if you're lying, if you're cheating, if you're not being honest, if you're making things up just because the person wants to hear it. People can tell. They can feel. Maybe, even if they cannot, how long can you pretend? So think about it from that perspective. And if you identify who you really are and you're true to that and honest to that, you will make yourself a competitive applicant. But think about all the extracurricular activities that are in line with your desires and wishes. Because if you say, okay, somebody told me that I have to do research, and you hate research, and you just don't understand why, then do something else. Do volunteering, do shadowing, get involved with organizations. There are really so many things that you can do. And I'm sure that you're going to excel. You're going to do a lot better in something you like than in something that you dislike.
Thank you for all your insight in this amazing presentation. To wrap up, do you have any final advice for our students?
Keep doing what you're doing. This has been a very tough year for students. So kudos to all of you. I think your strength and resiliency through this year and your ability to find the best out of everything. And this just shows that. This has been a very tough year and you took it, flip it and said, let's do something pretty with this. Let's make something that is worth our time versus being home and saying, oh, I'm so bad. I'm hit by COVID. My life is miserable. It's a choice. Everything in life is a choice. So I'm proud of your choices and I'm proud of all of you for being here. So thank you so much for hosting me.
Thank you so much for joining us. For all of my students, I have at the end of this, I'm going to show you how you can get your certificate that verifies your virtual shadowing hours with us today. In the meantime, this is just a few questions to keep in mind as you guys will be applying to various health programs in the near future. It's always a great thing to just slow down and reflect. Why did you join us today? What are 3 key takeaways from today's talk? And did any part of today's session resonate with you? I recommend making a document or having a notebook where you put in all of your certificates to keep track of them, as well as writing little reflections at the end of each. If you are looking to get published, you can have your reflection published on our official website. So like Dr. Lagreca was just saying, there's various things that you can do to stand out on your application. Being published is one of them. So if you are interested, find it on our website, prehealthshadowing.com/blog submissions. You can also submit articles, reflections, reviews, and success stories. Another thing that our professional pointed out today was mentors. And so if you are looking for a virtual mentor, potentially for life, you have the opportunity with pre-health shadowing to meet with up to 6 professionals in your field of interest. So to do so, as this is invite only, just a reminder that you have to post our bingo board on social media. Once you fill up your bingo board or have an equivalence to $136, you can go ahead and turn it in on our website for a spot reserved for you in our mentorship networking weekend program. So check out our website if you guys are interested for more information. Be sure to tag us on your posts whenever you do anything cool. We'd love to hear about it at Pre-Health Shadowing, and use the hashtag Pre-Health Shadowing. We are active on TikTok, Instagram, Facebook, and Twitter. And so if you're looking to make content, that is one of the things you can do as a volunteer. So listen up for the next parts of my presentation. If you are looking for easy volunteering hours, one thing that you can do is help spread our fundraising link. So we currently are using GoFundMe to raise money to keep our program alive. We are a student-led, woman-led nonprofit organization looking to fight inequity in health education and promote diversity in the various fields. And so not only are you gaining your virtual volunteering hours to benefit you, but you're actually benefiting not only the program, but thousands of students across the world. And so please take the time to raise money for our program and keep it alive and free. Thank you, guys. We are taking applications to join our student team. This is a leadership opportunity, 100% remote. You have lots of growth and opportunity for growth in your personal, academic, and professional development. It looks great on applications, and it gives you the ability to match with like-minded students across the world. And so if you are interested, you can apply on our website, prehealthshadowing.com/join-our-team. We understand you guys are all pre-health students, and time is not something you carry in your back pocket. So if you want to get involved but don't have the time to commit, no worries, we still got you. Pre-health shadowing has volunteering opportunities, which are super duper flexible. If you have 5 hours this week and 2 hours next week, and the only time you have is at 3 in the morning, that is more than okay with us. You can help us by doing professional nominations and student outreach. If you're interested in doing more hands-on projects and potentially leading your own project proposal, you can apply to be a hands-on volunteer through the same thing here. At the end of the volunteer training, you will be prompted to fill out your interests for hands-on projects, and we can get you onboarded with our Chief of Volunteering, Hannah Ng. So if you guys are interested, be sure to check us out on our website. You can also direct any emails towards volunteers@prehealthshadowing.com. We have some upcoming shadowing sessions next week. If you guys are interested, feel free to sign up on our website. And now, to get your certificate that verifies your virtual shadowing hours today, you are going to go to our website and find Dr. Lagreca's page on our website. You're going to click free, take this course, and you will have 30 minutes and 2 tries to get over a 70% on the post-shadowing assessment. As soon as you're able to obtain that 70%, I recommend hitting finish course and downloading your certificate immediately. You can always find your certificate in your profile under the certificates tab. Be sure to email us at info@prehealthshadowing.com if you have any issues or any questions about today's session. Thank you all for joining us. It was lovely to host you today. Be sure to check us back next week, and I hope to see you then. This is the end of our virtual shadowing session. I invite you to disconnect from the call.